Good day, lovely viewers. I'm in the person of Mariam, a fourth year biomedical laboratory science student of the University for Development Studies. In this video, I would like to discuss with you one of the health issues in our community, which is stroke. Stroke is also known as cerebrovascular accident, which in layman's terms means an accident that happens to the blood vessels in the brain. This normally occurs when the blood vessels in the brain gets ruptured and bleeds, or when there is a blockage to the blood supply of the brain. When this happens, oxygen is not able to get to the brain, and without oxygen, the brain tissues and cells get damaged and begin to die within minutes. So take note, within minutes. So it's very good to know the symptoms of stroke so as to prevent yourself from getting it in case you notice it in yourself. And the symptoms happen in the parts of the body that is being controlled by the parts of the brain that is damaged due to the stroke. Our brain controls certain parts of the body, and it depends on the part of the brain that is being damaged. Therefore, it's helpful for you to know to know the symptoms and seek for medical attention, because the earlier you seek for medical attention, the better your outcome is likely to be. These symptoms include paralysis, slurred speech, trouble talking to others and understanding what others say to you, vision problems, you see people too, or you're not able to see clearly, your vision is being blurred, and also loss of balance and control, severe or sudden headache, trouble walking, the person is not able to do things he normally does, and the face of the person begins to drop, the face of the person becomes uneven, as in one part begins like one part of the face begins to drop. And certain factors also put one at a high risk of getting stroke. This is also important to note so as to know how to take very good care of yourself. And this include family history of stroke. If you come from a family in which some family members have had stroke before or are suffering from stroke, you have to take very good care of yourself to prevent yourself from getting this situation. And people who are being overweight, people who live a sedentary lifestyle, and people with poor eating habits, who they eat unhealthy foods only, foods high in salt and fat and oil. All these predisposes one to diabetes and to getting stroke. Also, excessive alcohol intake and tobacco smoking also predisposes one to getting diabetes. And people who are being diagnosed of certain medical conditions such as diabetes, high blood pressure, and high cholesterol predisposes them to stroke. So if you are being diagnosed with any of these conditions, it's very important to take good care of yourself, take your medication seriously so as to control your situation and prevent it from escalating into stroke and other medical conditions. And stroke can be treated, and it depends on the causes. It is caused either by a rupture or a blockage. So when it's being caused by a blockage, medications will begin to dissolve whatever blocks the blood vessel, be it a plaque or a blood clot. So, and when it's being caused by a rupture, surgery can be undertaken to repair the damages. And it can also be treated through physical therapy and counseling depending on the stage of the stroke. Also, there are certain measures you can take to prevent yourself from getting stroke, which includes controlling one's blood pressure, avoid alcohol intake, avoiding tobacco smoking, exercising regularly, eating a balanced diet, and going for medical checkup regularly, which is one of the things we are all not good. We are not taking serious, and it's very important to be going for checkups regularly, because you might not know whether you are suffering from certain conditions, and when they stay long in your body, it will cause other severe problems. So it's very good for us to be taking care of our health, eat healthy foods, and also exercise regularly so as to stay healthy. As we all know, health is wealth. Thank you for watching.